Pig farmers will surely encounter situations like this at least a few times during the process of caring for pregnant sows and giving birth. Can you guess what the situation is? Let's watch my video to understand better. Currently, my sow has passed her expected due date and has not yet given birth, which makes me feel very worried. Over the past 2 days, this pig has stopped eating, shows signs of fatigue, and has begun to nest, but has not yet produced colostrum. According to my experience with previous pig litters, usually about 2 to 3 days before giving birth, the sow will begin to secrete colostrum. Even though I had prepared labor-inducing drugs, the situation still seemed unsettled and seemed to be beyond my control. The mother pig is currently having difficulty breathing rapidly, and is very weak, so I decided to call the veterinarian to check and evaluate the situation. While waiting for the veterinarian to arrive, I took the opportunity to cook bran and feed the pigs. In the barn, there is also another sow that has just given birth a few days ago and is quite healthy. I have been monitoring her health, and she seems to be recovering well from birth, which gives me hope that this pig and her litter will be in equally good health. Pig farming is indeed very difficult. Every day, I have to do many chores such as feeding, watering, cleaning the barn, bathing the pigs, preventing diseases, and cleaning the barn. If the pig litter grows healthy and disease-free, we can harvest and make a profit when we sell it. But if you encounter an epidemic period, you may lose all your investment capital. In the countryside, making money mainly depends on agricultural work like this. There are not many other options. Pig farming not only requires meticulous care, but also requires preparation and flexible response to emerging situations. Hopefully the situation will improve soon, and my sow will give birth smoothly. Thank you for watching my video. Wishing you productive working days and good health in your livestock work. After talking on the phone with the veterinarian about the mother pig situation, he immediately advised me to act urgently to avoid danger. Letting this condition persist can increase the risk of stillbirth and even affect the health of the mother pig. Dystocia, also known as dystocia, occurs when the fetus cannot be pushed out of the mother's body for a prolonged period of time, and is a fairly common condition in pig farming. The cause of difficult birth can come from many different factors. 1. Causes due to the mother. Narrow pelvis. A pelvis that is too narrow is a main cause of difficult birth. This often happens when the mother pig becomes pregnant too early, before her body is fully developed to endure the birth process. The sow is too old. When the sow is too old, her health may not be enough to give birth. The force of pushing becomes weak, hormones that stimulate labor are unbalanced, and the body no longer has enough strength to carry out the birth process smoothly. The hip semi-arthritic joint does not develop normally. This joint can become ossified, causing obstacles during the birth process. The cervix does not open completely. If the cervix does not open, or does not open wide enough, the fetus cannot pass through, leading to difficult birth. Amniotic fluid breaks too early. If the amniotic fluid breaks too early, the birth canal can become dry, making the birth process difficult. Uterine torsion. Uterine torsion at the end of pregnancy can prevent the fetus from being expelled. Vaginal stenosis. Vaginal stenosis that is too narrow can cause the fetus to enter the vagina but not be able to come out. Poor care. Mother pigs are not properly cared for. Sedentary and lack of nutritional care can weaken muscles and cause difficulties during the birth process. Infectious diseases. If the mother pig is infected with an infectious disease during pregnancy, this can also seriously affect the birth process. 2. Fetal causes. The fetus is too large. If the fetus is too large compared to the size of the mother's pelvic cavity and genital tract, giving birth will become much more difficult. Abnormal position or direction of the fetus. If the fetus is horizontal, upside down, or incorrectly positioned in the uterus, this can cause problems with childbirth. deformed or teratogenic fetuses. These fetuses may have an abnormal shape or structure, causing difficulty in the birth process. How to recognize difficult labor. Time lasts from 6 to 12 hours. If the sow cannot farrow after this time, there is a high possibility that dystocia is occurring. Intense pushing. The mother pig will have intense pushing. You can see her stomach and feet scratching the ground. Pigs will feel restless, need to urinate, and each time they push, they will see their back arch and their hind legs spread out. Pushing becomes less frequent. If pushing becomes less frequent, the animal may become tired, have rapid respiration, and a faster pulse. The mother pig's body temperature may drop. Water breaks and cannot give birth. If the mother pig's water has broken, but after 5 to 6 hours the fetus still does not come out, this is a clear sign of difficult birth. Interventions when having difficulty giving birth. 1. Difficult birth due to too dry birth canal or premature rupture of membranes. Use Vaseline to lubricate the mother pig's hands and vagina. Clean the sow's vulva and use your hands to pull each fetus out according to the mother's pushing rhythm. 2. Difficult birth due to weak pushing force or no pushing force. Stimulate the sow's urge to push by rubbing the pig's udder, 2 to 3 minutes, or stimulating the sow's vagina. Then wait for the sow to give birth. 3. Vaginal stenosis. If the vagina is too narrow, it is necessary to widen the vagina with a surgical procedure and then pull the fetus out. Abnormal position or orientation of the fetus. Adjust the fetal position to normal position and then pull the fetus out. 5. The fetus is too big. Consider the condition of the fetus and intervene manually to pull the fetus out or perform a cesarean section if necessary to save both mother pig and piglet. Once the veterinarian arrives, he will examine the mother's condition and determine the specific cause of the dystocia. The doctor may decide to administer drugs to induce labor if the situation allows, but this must be done very carefully. If the mother's water has not broken and the uterus has not opened, the use of farrowing drugs should not be performed. While waiting for the doctor, I prepared some medicines available in the house and asked for more opinions to see if they could be used. After the infusion, the mother pig was able to stand up, but was still very weak. I gave the sows warm water mixed with a little salt for added support. Next, I checked the fetal position according to the doctor's instructions, used Vaseline to lubricate my hands, and opened the cervix according to the rhythm of uterine contractions. This sow was in such severe difficulty giving birth that she no longer had the strength to push. In this situation, I had to intervene directly with my hands to help pull the piglets out of the mother's womb. Luckily, the vet was there promptly, monitoring and guiding me through the process, ensuring that everything was done properly and as safely as possible. After being born, the first pig was very weak, but I quickly cleaned it, cut the umbilical cord, and placed it in a warm brooder to keep it warm and healthy. However, during the birth process, the following piglets encountered suffocation problems, leading to the death of many. Out of a total of 15 piglets, only 4 survived, while the remaining 11 did not survive due to suffocation in the mother's stomach. For anyone who works with pigs, this is a heartbreaking and difficult experience. Even so, I still had to do my best to save the remaining pigs and ensure they had a chance to survive. Monitoring the condition of 4 newborn piglets, I noticed that 2 of them were very weak, and 1 of them did not have the strength to suckle. Even though I tried to bring them to my mother's breast to suckle, they couldn't suckle on their own. To help the mother pig recover after giving birth, I need to let her rest and give her some anti-inflammatory injections to support the recovery process. In the coming time, I will continue to monitor the health of the mother pig and take careful care of the young pigs. Finally, after endless efforts, only 2 young pigs remained. To ensure they had a chance to live a healthy life, I sent them to be placed with a newborn mother pig in a neighboring pen. This not only helps the newborn mother have time to rest, but also helps the young pigs to be cared for and develop better. To prevent difficult farrowing in sows, I have learned some important lessons as follows. 1. Choose gilts with proper technique. Make sure to choose gilts with appropriate appearance, small head, gradually getting bigger towards the back, and eliminate deformed pigs, small pigs, with pelvises narrow, or the sow is too old and weak. This helps reduce the risk of difficult births and ensures the health of the mother pig. 2. Proper care and nourishment. Make sure sows are fully cared for and nourished to maintain good health and not get sick, especially infectious diseases. During the final stages of pregnancy, it is necessary to pay attention to careful care and appropriate exercise for the sow to help the birthing process go more smoothly. 3. Keep sows in separate and clean pens. Ensure that sows give birth in a quiet, clean, and comfortable environment to reduce stress and the risk of problems during birth. 4. Proper birthing techniques. During the farrowing process, it is necessary to carry out the birthing steps correctly, avoiding making noise or stressing the sow. Proper delivery will help the mother pig and fetus have the best conditions for successful birth. In addition to the above measures, if you have more experience or other prevention methods to minimize the problem of pigs having difficulty giving birth, please share in the comments section. Your contributions will be invaluable not only to me, but also to the livestock community. Thank you for following and sympathizing with this challenging livestock work. I would like to extend my heartfelt thanks to all of you who took the time to watch this video. Your support is a great motivation for me to continue sharing useful knowledge and experiences in animal husbandry. Please don't forget to subscribe to the channel so you won't miss any of our latest videos. If you found this video helpful, please share it with your friends and family. Also, we highly appreciate your feedback. Please leave your thoughts or questions in the comments section below so we can discuss and share experiences together. Thank you very much.